Hi, this is Dr. Ari Isaacson at IR Centers Raleigh, here to give you some information about the PAE procedure in preparation for your consultation. PAE stands for Prostate Artery Embolization. And embolization is the term for cutting off the blood supply to a target. So the purpose of this procedure is to block the blood that is flowing to the prostate. The result is that the prostate is starved of oxygen, and because of that it shrinks and it softens. That allows the urine to pass through it more easily and more completely. This procedure now has been FDA approved for about 9 years, and we've been doing this procedure here for quite a while and have done thousands of these procedures. The procedure itself is not painful, so because it's not painful, we do not do it in a hospital and we do not put patients to sleep for it. We have an outpatient facility and we provide some relaxation medication prior to the procedure. The procedure takes about 40 minutes to do, and the way that we go about it is we numb up the skin in the upper thigh groin area, and then we insert a small catheter about the width of a piece of spaghetti into the artery there. We manipulate that catheter through the arteries using X-ray for guidance until we get to the branch that supplies blood to the prostate. Once the catheter is in that branch, we inject microscopic particles that are intended to block off the artery so the blood can't get through. The prostate has one main artery on each side, so we repeat that same process on the other side as well. However, the vast majority of the time we do this all through the same puncture in the skin, so just one puncture. Once the procedure is complete, patients recover for 2 hours lying flat to reduce the risk of bleeding from the arterial puncture site. Once that 2 hours is done, most patients go home without any pain or side effects. The main restriction upon leaving is that we ask that you don't lift heavier than 15 pounds for 3 days, and that's also because we don't want to risk that artery bleeding again. The night after the procedure, there are some side effects that will begin, and these include very frequent urges to urinate, burning with urination, and some degree of pain in the penis. These symptoms will last 3 to 7 days, and we prescribe medication to help alleviate them so they're more tolerable. The improvement in urination from this procedure will not occur immediately. It takes around 2 weeks for those symptoms to start to get better. And initially the changes are going to be subtle and they will progress over the course of 3 months. So it takes 3 months to experience the full benefit from the procedure. This procedure is very safe because it's minimally invasive. However, there are some complications that occur rarely, and they include blood in the urine, blood in the stool, blood in the semen. If any of those 3 were to occur, they would resolve on their own within about a week or so. In very rare circumstances, in about 1 in every 250 patients, it is possible to develop a sore on the tip of the penis after the procedure. And this occurs because the particles that we inject go down arteries that are headed to the penis. We try our very best to prevent this from happening every procedure, but in very rare circumstances, it is unpreventable. If this were to occur, the sore would be painful for anywhere from 1 to 3 months, but it would then heal completely without any residual deficits. The procedure itself has little to no effect on sexual function. This is one of the differentiators from other procedures for BPH. The chance that this procedure will be effective and improve urination substantially is about 80%, and that's pretty good. However, it still means that there will be 20% or 1 in 5 patients that will require additional therapy after this procedure. The duration of the effect of this procedure is not infinite, meaning it doesn't last forever. The average time that this procedure works for is around 5 years. We have had some patients who have had this procedure done and the effect has lasted 10 years. Other patients have come back and had it redone within 2 to 3 years. But the average is about 5 years. And the procedure can be done again at any point if symptoms return. Additionally, any other procedure can be done after a PAE. It doesn't preclude any other treatment for BPH. The last thing that I will tell you is that PAE is covered by most private insurances as well as Medicare, and we are in network with most private insurances. Thank you, and we look forward to talking to you at our consult.